Hi, Jeff Waite here, pharmapricing.org. Thanks for stopping by. I'm working with my associate Larry Gorkin, and we're looking at Me Too drugs right now. Last video, we examined the unintended consequences of FDA guidelines for new anti-diabetes treatments. Today, we're going to continue on that scope and zoom in on a few case studies. Now, just before we get started, for the sake of clarity, we're using the term first-to-market drug, and that's one that transforms efficacy and safety. It changes the calculation, the hazard ratio in a given disease and indication. Now, another thing that's important to remember is that even when the drug is not first in class, first-to-market, the term is also invoked if that drug alters the efficacy and safety balance in that particular disease indication. So those are just, for convention, some of the terms that we're using. So the first drug we're looking at is Merck's Januvia and Janumet as well. Now this is a novel class of oral medication that treats type 2 diabetes, approved third quarter 2006 and went on to achieve blockbuster status by 2008. It showed strong revenue growth since that time. You can see here in the chart, as well as in the graph, these numbers are hundreds or millions of dollars. So that's $3.3 billion in 2010. Now, let's compare that to Bristol Myers and AstraZeneca's saxagliptin, marketed as Onglyza, which was approved in the third quarter of 2009. So the second drug to market, very similar, and the drugs do, the differences do appear to be marginal. The dosing of the Bristol Myers drug is a little bit more convenient, but other than that, the pricing is pretty much just the same. This is really a Me Too drug. Now, traditionally, BMS and AstraZeneca could probably expect about 20% of the revenue just for creating another treatment option for such a large and growing disease indication. In 2010, there's about 25.8 million diabetics in America, and that's expected to continue to rise going forward. But you'll see that this is certainly less than 20% here. Since this BMS drug is priced equivalent to Januvia or Janumet, which is the sitagliptin formulated with the metformin, which is the traditional diabetes treatment. Anyways, as we mentioned it earlier as well in the last video, that Big Pharma tries to avoid competing on price. But in this instance, it means that doctors are given two very similar choices. Now, Merck's version has been out earlier and has an established safety record, so if you're a doctor prescribing to a patient, intuitively, chances are that you're going to go with the proven option. Also notable is Novartis' vildagliptin, marketed as Galvus. It's not approved in the U.S., but launched in 37 other countries and has generated $391 million in 2010. This is data that my associate Larry Gorkin, who's worked at Pfizer for 13 years, brought to my attention. And looking over this, see that even in the absence of differential pricing, the first to market in this case generates more than 6 times the sum of revenues of the other two agents we looked at. So once again, that's 6 times the sum of the revenues from the first to market when compared to the other two. So I hope that gives you a brief look into the end of the Me Too era and what the implications are, what it means for pharma companies, and what it's going to mean for health outcomes, managed care, and treatment options. This is just a very brief look. We have about 3 or 4 other case studies and are working on a few more. So if you're interested in getting the full package, if you have any interest in how Big Pharma continues to make millions of dollars, sign up using the form on your right. Enter your name and email address to get this comprehensive report. We are your trusted authority with pharma pricing information. If there's anything that you want to see covered in a video, please do let us know by email or by comment, and we will investigate. So thank you very much again for stopping by. Jeff at pharmapricing.org.